North Carolina Governor Roy Cooper announced this week nearly $8 million to support mental health programs for universities and colleges.
There's been less state-funded support in South Carolina, where districts like Rock Hill are creating solutions and advocacy within their community. WCNC Charlotte's Colin Mayfield spoke to the director of mental health for Rock Hill schools on what's working within the schools and what's not. Colin?
Yeah, Fred, Vanessa, it's good to remember that every district, their needs are going to be different here. Rock Hill's needs in terms of mental health help are immense. So they've worked on improving access in the district's own Department of Mental Health.
The only true hurdle is the amount of referrals that keep coming in, and we certainly want to see every child that needs a mental health therapist.
That's Dr. Nancy Turner, Director of Mental Health at Rock Hill Schools, explaining that while students' needs have changed, the district worked to find a proactive response.
Certainly there are other districts that are still struggling to find therapists.
In a report in May of last year, the South Carolina Department of Health and Human Services got a failing grade showing there were not enough counselors to cover even half of the public schools in the state. Dr. Turner says they felt the fallout from the pandemic coming, knowing they'd need extra help. She says they worked within the district to improve access for students to counselors and therapists called site-based therapy.
It's our behavior management assistants in elementary and preschool and our crisis management assistants in our middle and high. These are individuals who are highly trained.
At a recent school board meeting, Dr. Turner spoke on what's working within their schools, like the behavioral and crisis management units.
We are managing to see as many students as we can, but there will be more referrals.
Access and advocacy are two factors licensed clinical social worker Tyler Keith has highlighted when working with school districts.
We just need to give students, teachers, and professionals time and space to build impactful relationships so students have the ability to utilize the resources they're given.
He says many of his clients are teachers that have so many other pressures, but they realize mental health is becoming a topic where they need tools in the classroom.
And so by putting the service providers right in the pockets of schools.
An approach Rock Hill is focused and ready to invest in.
To take a look at next year's budget as our referrals and needs increase.
So to try and shore up some of the funds, and like many other districts, they're doing this. Rock Hill schools are looking for unique partnerships strictly dedicated to mental health. One of their biggest partners actually is Cincinnati Bengal Hayden Hurst and his foundation, focused on improving resources and awareness.